We at LAPO are committed to poverty eradication. We equally believe that the battle against poverty requires the effort of everyone.
Hello everyone, welcome to another edition of Bridging the Gap, a program produced by LAPO Poverty Organization LAPO. Patience Nakumwana is my name. And on the program this morning, we are going to be talking about healthcare in rural Nigeria. We know that people living in rural areas of Nigeria, they lack qualitative healthcare system, including good hospitals, professionals, drugs, and even health awareness programs which would help educate them on how to live a healthy life. So on the program this morning, we're going to be talking about barriers, some of the barriers to healthcare and disease prevention in rural Nigeria. And I have in the studio with me this morning to be talking about this Dr. Andrew Ojeibun. Doctor, you are welcome to the program.
Thank you, madam. My pleasure, and good day, viewers.
Yeah. Dr. Andrew Ojeibun is from the Department of Public Health and Community Medicine, University of Benin Teaching Hospital. All right, doctor. So why do you think rural healthcare is important?
Yes, rural healthcare is important because, number one, the people living in the rural areas are humans. They are as humans as those in the urban areas. So we are all equal. So if those in the urban areas have a right to health, then they also have the right to health. Because health is a fundamental right for every human being. And it is the government's social responsibility to ensure health for the citizens. So, as I said, it's a fundamental right, so it's important. Secondly, there are peculiarities with the rural areas, okay, because of their, the disadvantage, if I use that language, okay, because of they are hard to reach. It's a remote area. Some amenities are not really available, okay, and they have, in fact, if you do a comparative study between the urban area in terms of certain mobilities, you will find them more in the rural areas. You understand? And so it's important that we must take good health care, quality health care to the rural areas and make them accessible and affordable.
Okay, are there barriers to quality healthcare services in these areas?
Yes, yes, there are barriers. There are barriers, especially in rural areas. Let's tackle it first of all geographically. As I said, some of these areas are so remote that even when you compare the distance between the households to the only or functional health centers that they have, the distance can be very frustrating, because if somebody has to trek, maybe an elderly man has to go a long mile, trek or ride the bicycle to get to the nearest primary center that is so far away, ideally, it should be within easy reach. So that is a barrier, and sometimes they will not want to go that far. Secondly, there are no good roads. For you to be able to access healthcare, your mode of transportation is also key, because when you have an emergency, for example, you need to be able to get to the hospital fast enough. Okay, and when you cannot achieve that in good time, that is a barrier. Okay, and then look at also economic access. Most importantly is poverty. More of these rural dwellers are really poor. Not many of them can pay for health care, and so they would rather take alternatives than seeking health care. Okay, because there were times I've been to the rural areas. When you organize medical outreaches, they are happy to come out, and when you see them, you interact with them, they tell you that they've had this condition for a long time, and you're asking them, what have you been doing about it? And they say, no money. And so that is a major barrier, that they are poor and they cannot afford health care, and more of the time they do not even have social insurance, which we can find in the cities or in formal setups. They don't have social insurance that will enable them to still achieve health care even when they don't have finances to run. And then don't also forget that because it's a rural area, some of these people have cultural predilections. There are cultural barriers. Their behavior, their health-seeking behavior is quite poor for some people. Okay, of course, there are people who are educated that are in the rural areas as well, but the majority are not educated, they are not informed, they are not enlightened about their health. they have poor seeking, they have poor health-seeking behavior. So when they are ill, what comes to their mind first is to either go to a patent medicine store or patronize traditional, healers, or those who are pregnant take deliveries in, delivery homes that are not competent to handle such deliveries, and when complications come, that is a different ballgame entirely. So these are barriers, cultural barriers, really, and so those are the things that we try to surmount, when we want to intervene.
All right, doctor, let's finally look at solutions. Let's look at the way forward. How do we improve healthcare in these areas, in the rural areas?
So first, I will tackle it from two perspectives. First, from the community level and from the government level. At the community level, when we come into communities and we understudy the prevailing health problems, that particular community, because every community has their peculiarities, okay? And so we need to carry out community diagnosis, conduct some research, get to know what their felt needs are. The people must first of all agree that they have a problem, and then also participate in the process of bringing out solutions to their problems. And it is when they are all involved, that they now own, the projects or the interventions, or the solutions that come on board. So we will ensure, these people are involved, advocacy, social mobilization, community mobilization, which will involve a lot of health education and health promotion activities. We want to educate them about, certain, harmful cultural practices which they should desist from, and also reinforce or promote the good habits, because it's not every cultural practice that is bad. Some are good. Coming from the government perspective, government, as I said earlier, has its core mandate to ensure that the citizens are healthy, because if your citizens are not healthy, they will not be productive. That means the economy will also be stranded. And so government all over the world, it is a general consensus, even based on our sustainable development goals, okay? SDGs 1, 2, 3, and thereabout. All is geared towards ensuring that there's equity in health distribution. Healthcare should not only be a product for the rich, it is also a product for the poor. And so there must be equity in distribution. And that comes to government ensuring that there is equity in distribution of healthcare services. Okay? What we find most times is most of our manpower in the health sector are located in the urban areas, leaving very few, to man the rural areas, and that is a disproportionate distribution. So we want more persons, more manpower, more doctors, nurses, CHIUs, and other cadre of health workers, to man our primary health centers. And that's why we have primary health centers, because that primary health center is the closest unit, where healthcare delivery takes place. So we may not have the benefit of having a hospital like EBTH, in a rural community, but we have primary health center, and it is the goal of every government to ensure, like I also know from this government, even it's a national consensus that every ward should have at least one primary health center. That will reduce the time lost, in trying to access, those health services. That will encourage people to come out. That will change the health care seeking behavior.
Yeah. Thank you very much, Doctor, for spending this lovely Saturday morning with us. Yeah, we appreciate you. All right, we've been talking about barriers to healthcare and disease prevention in rural Nigeria and the way forward. And the way forward for us, I'm going to add to what Doctor has been telling us. We're going to read from a report that I have here. With the concentration of poverty, low health status, and high disease burden in rural areas, there is a need to focus specifically on improving the health of people in rural and remote areas, particularly if the urban drift is to be reversed. The World Health Organization International Development Program has highlighted this with specific objectives for policies and action which promote sustainable livelihoods, including access for people to land, resources, and markets, as well as better education, health, and opportunities for rural people. These objectives seek to contribute to lowering child and maternal mortality and to improve basic health care for all, including reproductive services. That has been on the program for today. For those who want to reach out to us, you can do that through by sending us text messages. Our social media handles are on the screen. You can also walk into any of our offices and you would be welcomed. Till we come your way again. Bye bye.